I absolutely agree with you. They are very dedicated, very good people working in the field of long-term care, right along with some folks that aren't so dedicated. And so it is, really, you want to understand what are the markers so that you can figure out where you're likely to get long-term care.
I've been a pastor, and I have observed in different sizes of communities and places, and I've often gotten into the mix of recommending a nursing home. And my general observation developed over decades is that if you want to really be sure that things will change once your relative's in a nursing home, go to a smaller town nursing home, because there's a grapevine in those communities, and they tend to put things right that are not right in those nursing homes.
I actually hear that a lot, and we do trainings around the state in nursing homes based specifically on their poor care. So facilities that are doing a poor job. And I have to tell you that there are some really consistent offenders in small towns, just like there are some really great ones in small towns. And one of my favorites is out in western Kansas, and I mean the very far southwest corner out by Elkhart. And it's a Mennonite community, and they do a fabulous job in a teeny tiny nursing facility. But there are other facilities just down the road that are also tiny and community driven that are not doing such a good job. So you need to know, and you need to look for those things. Did you also have a comment or question?
Well, I have a comment that's a little bit related, because I spent quite a bit of time visiting a particular person in an area nursing home. And what I observed was that the person I was visiting was articulate, and he interacted with everyone, all of the staff, and with a good attitude of mind. At the same time, I would observe other people who seemed to me to be almost totally neglected. I think of a man who seemed to be quite inarticulate. He was able, when he needed to use a bathroom on his own, but otherwise he just, essentially lay on a bed with his face to the wall. And it seemed to me he was just neglected. And then there was a spectrum of other people that I would see regularly. And it seemed to me that too much depended on the initiative of the patient because personal interaction is what keeps you alive.
It certainly is. Yeah, and that's really critical, and again, that goes back to the number of care staff that are available in a facility.
And they will react, and they will be drawn to people who take the initiative. They should perhaps have a better sense of balance, but that's what happens.
You know, when I mentioned this resource to you about more person-centered care, it really is a movement in our state right now that we've done a lot of work and training in nursing facilities across the state and with consumers about, because it really is about what are your preferences, how do you make decisions, how do you get the kind of care that you want to get in a facility, so that you get to make the decision about when you get up, when you go to bed, what you eat, what you do for activities, the things that we take just for granted when we live in our own homes and are able to do what we want to do. But that's not always the case for people in nursing facilities, so having adequate staff and being in a facility that really embraces this approach to care is very important. For providers of care at home that really embrace this approach is important. There's one other thing I want to mention to you, because I'm sure I've talked way longer than I should have, and that is that our organization once a year tries to recognize somebody who has done an outstanding job of promoting quality long-term care in our state. And we've had the pleasure of recognizing 5 different individuals. One of them was Rosemary Chapin, who's a professor in the School of Social Work and has worked with older adults in long-term care for her entire career. This year it's our pleasure to recognize another person from Lawrence, Sandy Prager, who is our current insurance commissioner and who has previously served in the Kansas House and Senate. Sandy has done some pretty great things over the years for long-term care, and it's a pleasure at the end of her public service career to be recognizing her. So the event is on October the 26th. It's at Maselli's downtown. It's from 2 to 5 in the afternoon. There is no fee or charge to attend, and we would welcome you to come and celebrate Sandy's recognition. If you want to make a contribution, you're welcome to do that. If you want to buy an auction item, you're welcome to do that, but that's not part of the requirement. So if you are interested in coming and could let our office know, that would be great. And if you could let us know within the next couple of days, that would be even better. So that way we have enough chairs and food for people when they come. But I want to tell you how much I appreciate the opportunity to talk with you about long-term care. I want you to know that we are really, as an organization, there are 800 volunteers and members across the state. You're welcome to join us as a volunteer or as a member. You are welcome to come to the legislature and testify with me anytime you want to about an issue of interest or concern to you. I'm always happy to help put people in touch with legislators that are interested in issues of interest to you. And I would very much welcome any interest in working with KABC on the things that we're trying to do to improve quality care that you might have an interest in doing with us. So if you have other questions, I'm happy to respond.
I see you require 90 hours for nurses aid training. Is there a requirement in law for the administrators of these nursing homes?
Actually, administrators have a pretty good set of curriculum and requirement. They have to do 480 hours of training, and that is both classroom and what they call a preceptorship with an already existing licensed administrator. So they actually get a pretty good induction into management of a facility before they start working as an administrator. That is not true for assisted living facility operators. In our state, there are two different standards. You have an administrator for a nursing facility or an assisted living facility that has more than 60 residents. But if it's a small facility, like a Home Plus that has 8 or 12, or if it's an assisted living facility that has fewer than 60, we have a shameful standard because you have 40 hours of training, you have to have a high school education, and that's it. And that's it. And those people are charged with hiring healthcare professionals, overseeing the healthcare of people in their care, hiring and firing. And I can tell you, I've been managing people a long time. Coming out of high school with 40 hours of training, there's no way I could have done a reasonable job of that.
You just explained what my relative is facing in Great Bend, Kansas.
Yeah, and again, those are health and safety standards that we hope to be working on in this legislative session, because the state came forward with a proposition this year on how to improve operators of assisted living facilities, and what they came forward with was we're going to make every operator be certified, so that if the Department of Aging secretary doesn't like how that operator is functioning, they can pull that person's certification. But they did nothing to increase training requirements or education requirements or anything that would actually have a quality impact on the older adults in their care. When that legislation came forward, we asked for that it either be a 4-year degree or a licensed nurse who would be the operator of an assisted living facility like that. And we didn't get any place with that amendment. So those are the kinds of health and safety standards we have a concern about and will go forward with in this next legislative session. Anything else?
When you get the rules and regulations, how about money for enforcement?
When we get the rules and regulation, how about money for enforcement? Every time there is a new law or new regulation, they do what they call a fiscal note. And so laws and regulations are not passed separate from the fiscal note. So if there's no fiscal note, then there's really no implementation of any law that is passed. And typically in our state, since the downturn of the economy in 2008, if there is a substantial fiscal note, it does not happen. I mean, the legislation just doesn't pass.
Thank you very much.
Yeah.
I do have another question. There are many churches in Lawrence that have Stevens ministers.
Yes,
Do you think it would be a good idea as a part of their training that they are taught how to observe for conditions in nursing homes on the patients that they visit?
I think that would be a wonderful idea. Hospice workers do that now, and I neglected to mention to you that there is a program called the Long-Term Care Ombudsman Program, who is authorized by the federal and state government to act as an advocate for people who live in nursing facilities. And if you don't know about that program, it's an important one to know about. But absolutely, Stevens ministers do such a great job, and yeah, that'd be great. So I'm happy to stay around and answer other questions, but thank you so much for the opportunity to talk.
Mitzi's really doing a terrific job. If there's anyone who I would like to promote as a speaker for various events, it would be Mitzi McFatrick, and I'm in the process of doing that now. Mitzi. Do come to the reception, that's what we're calling it, the reception that will be on the 26th. And one of the questions I wanted to ask you, Mitzi, will legislators be there?
Some of them will.
Okay, very good. You might do a friendly contact with your own legislator and make sure that he or she knows that she's been invited to participate. It's a great opportunity for them to get in touch with the kinds of stuff that the advocates for better care are working on. Thanks again, Mitzi, and thanks to all of you for your attentiveness to Mitzi's presentation.
I'll get my